I've been interested in ophthalmology for years, actually. Even before going to medical school, I really felt that I wanted to be an ophthalmologist. I went to medical school in Chicago and did my residency at New York Eye and Ear Infirmary. And then I was up in Boston for a while at Mass Eye and Ear Infirmary with Harvard Medical School for a retinal fellowship. I've always been very interested in what's coming next and what the new treatments, devices are. So I've made sure that the practice has stayed active in clinical trials. I think it's a great opportunity to bring new treatments to patients that we think are probably the next great thing before they're ready for prime time to evaluate them. And thankfully, we've been involved in a lot of trials over the years that have become the next treatment. For instance, for macular degeneration and diabetic retinopathy, there's several medications that we use every day that we were involved in the clinical trials for many years ago. The two things that I would say have changed the most that I am involved in every day are macular degeneration, the wet macular degeneration in particular, and the treatment of diabetic retinopathy. Before we had intravitreal pharmacotherapy, intravitreal injections to treat these conditions, it was not a pretty picture, and particularly for wet macular degenerations, patients would lose vision from that. Now, I've lived through an era where it was, kind of a no option situation for the patient and they were going to lose vision, to one where typically we can improve vision and they can, keep their vision and stay functional. So that's been a tremendous change to witness. The next step is not having to treat patients every month or two to maintain our gains. So many things are being looked at, from longer acting injections to some of the things that we do now involve injecting small pellets or a small rod that's impregnated with drug, and the drug slowly leaks out into the eye. In one case, there's a treatment for diabetic retinal disease where that can last for 2 or 3 years, for instance. So that's really the next step, is to take some of these advances that we've made with respect to intravitreal injections and have that translate into longer acting therapies.